Hello, welcome to my Sportsman 3 project about craniotomy by Coral Bannister-Ozer. Craniotomy surgery is used for most skull surgeries as it allows for surgical access to the brain and is the first step in brain procedures. Craniotomy surgery is used in cases where patients experience brain tumors, aneurysms, bleeding or swelling, brain injuries, fractures, vascular issues, and epilepsy. During preparation for surgery, a few things will happen. First, the patient is given anesthesia, making them pain-free during the surgery as well as asleep to limit movement. In some cases, however, the patient is kept awake but pain-free. This is to be able to monitor their symptoms better. Second, the patient's head is shaved near the incision area. Lastly, the patient's head is immobilized and IV fluids and a catheter is hooked up to monitor the patient's vitals during surgery. During surgery, a portion of the skull needs to be temporarily removed. For this to happen, an incision is made, making a skin flap and revealing the skull. Then, a drill is used to make one or more small holes in the skull. Lastly, a saw is used to cut between the holes. This creates what is called a bone flap, which is temporarily removed bone. During the third stage, the procedure is performed. First, the dura mater is removed, then the reason for the surgery happens. This could be many things: a tumor being removed, which is most common, an aneurysm being clipped, or a blood vessel being repaired, as well as a device being installed. Once complete, the dura mater is closed once finished. Lastly, the skull is closed. After the bone flap is replaced, it is secured using small plates, screws, or sutures. These are permanently installed, then the scalp incision is shut. Craniotomy surgery is often confused with craniectomy surgery. This is due to being extremely similar, so I thought I would explain what exactly the difference is between the two. The main thing is the bone flap is replaced during the same surgery for a craniotomy, but for a craniectomy, the bone flap is replaced later in an additional surgery. The second difference is that craniectomy surgery is used to relieve pressure caused by brain swelling, bleeding, or seizures. Craniotomy surgeries are typically used to remove tumors, aneurysms, or brain bleeds. As an additional reminder, my project focuses on craniotomy surgery. However, my recovery program is used for both surgeries, with some things being altered.
To begin, your surgeon will make an incision in your scalp. One or more small holes will be made in your skull. Then your surgeon will connect the holes to create a circular piece of bone called a bone flap and remove it. Your surgeon will make an incision in the dura mater to expose your brain. Then your tumor will be removed. The incision in the dura mater will be closed with sutures. Your surgeon will reattach the bone flap with metal plates and screws that will remain in your skull for life. You may have a variation on a craniotomy called a craniectomy if your brain is very swollen or your skull is infected. Your surgeon may delay reattaching the bone flap until a later procedure to allow time for the swelling to go down. At the end of either a craniotomy or a craniectomy, your scalp incision will be closed with staples, and your head will be wrapped in bandages. If you had a craniectomy, you will have another procedure called a cranioplasty at a later date after the swelling goes down. At that time, your surgeon will reattach your bone flap with metal plates and screws. Then close the skin incision with staples.
My recovery program includes a lot of rest for the patient to avoid fatigue. Walking is encouraged daily for about 5 to 10 minutes, and then increasing the time each day. Strenuous activity is limited, avoiding lifting objects that are more than 10 pounds until the patient is cleared by a doctor. Avoiding head trauma is crucial for recovery. As a result, patients aren't cleared to be involved in contact sports for about 6 to 8 weeks. Additionally, it is important patients avoid driving until cleared, bending over more than 90 degrees at hips, and holding their breath as it applies more pressure to the head. Rehabilitation focuses on returning a patient back to their everyday lives. In physical therapy, strength, balance, and movement is focused on. Speech therapy assists in improving communication and speech skills. Occupational therapy focuses on relearning how to do daily tasks. Cognitive support assists in supporting concentration skills and memory. Lastly, a doctor may recommend a protective helmet, which protects the brain during rehabilitation. Thank you for listening and watching my SportsMed 3 project on craniotomy surgery.